You work in communities in India where air pollution is a significant cause of mortality, and your organisation, Healthcare Without Harm, is a leading voice, both calling to end the fossil fuel use to protect human health and decarbonise the health sector as a whole. And I think we haven't perhaps talked as much about that as we might do today. Why is the energy transition so critical for health and healthcare? And what solutions does the global economy need to take forward to realise these health gains?
Thank you. I would like to start with mentioning that this year has been yet another sobering reminder that the climate crisis is not a distant possibility. It's a present reality. We live it, breathe it, and wrestle with its consequences daily. Our civilization's dependence on fossil fuels drives the climate crisis and therefore is the greatest threat to human health today. Our bodies, communities, and ecosystems bear the scars of a planet pushed to its limits. We're paying the price of our society's addiction to fossil fuels with our health. In 2020, during the pandemic, the total fossil fuel subsidies amounted to almost $6 trillion US, and while the combined spending of all governments on health was $9 trillion. Healthcare professionals around the world are witnessing firsthand the human health impacts of climate crisis. Our nurses, doctors, and frontline health workers are the first responders to this crisis. Now, we cannot adapt our way out of a 2-degree or a 3-degree global temperature increase. So our solutions must focus on prevention and addressing the root cause. And our approach should move beyond treating just the direct health consequences to demanding both political action and accelerated finance for a fossil fuel-free future. And we can only be successful in tackling the climate crisis when we join forces with other sectors in the society and address the root cause. We, as a health sector, can be a powerful catalyst in the just transition. And that's why I'm heartened that last month, health leaders representing more than 46 million health professionals called on the COP28 presidency and the world governments to commit to a rapid, just, and equitable transition away from fossil fuels towards clean, accessible, renewable, healthy energy. And when we are thinking about transitioning to a low-carbon economy, we must ensure that the socially and economically unjust patterns of a fossil fuel economy are ended and not repeated. And health cannot be a mere co-benefit of a just transition. It should be the driving force. Now, let's also remember that healthcare sits at the epicenter of our collective climate trauma. And the uncomfortable truth today is that the health sector itself is contributing to the climate crisis by its own greenhouse gas emissions. Now, many health systems, public and private, around the world are taking action to shift towards low-carbon, climate-resilient, sustainable health systems. In order to align the health sector with the commitments of Paris Agreement, we must accelerate the health sector decarbonization in high-emitter countries and invest in low-carbon, climate-resilient health systems in low-emitter countries, with all of health sector reaching net zero by 2050 at the latest. Finally, I think I would say that this is the moment of transformative leadership and bold decisions. And this brand of leadership requires sacrifices, not of people and communities. We need the willingness to forego profits and shifting of societies that treat our people, animal, and planets as expendables to valuing health. I would like to end with the fact that the essence of the Hippocratic Oath of first do no harm is calling upon us to take on this climate crisis in this moment now, because later is too late. So let us not view health as a casualty of climate change, but as its compass, guiding us with just and equitable solutions into a fossil fuel-free world where no one is left behind. Thank you.
Shweta, thank you.